Okay, thanks for being here. My name is Carrie Drinkwine. I'm a regenerative detox specialist. Most of you know me. If you are a guest, you've been invited by somebody that wanted to share this information with you. And today our topic of conversation is IBS, IBD. So IBS is inflammatory bowel syndrome. IBD is inflammatory bowel disease. Colitis and Crohn's are all basically another sector of IBD. So I'm going to break all of that down today, define what it is, how it happens, and how you come to solutions to help your body regenerate from these conditions. So I'm going to pull up my notes to keep me on track, and I'm actually going to share my screen with you as well in just a moment here. But first thing first is IBD can be inflammation in the small and or large intestine. And so I'll start with just a little statistic for you first. And so something that was really shocking is when I started studying with Dr. Zach Bush, and I learned that more than 80% of Americans specifically have reported bowel disorder or dis-ease of some sort. So whether that's IBS, IBD, Crohn's, colitis, leaky gut, allergies, chronic constipation, belly bloat, you name it, 80%. So that means out of 17 people on the call, at least like 14 of us have said some sort of inflammatory bowel issue. It's a big deal. It needs to be talked about. And when you look at, statistically speaking, when you go through, seeing the rest of the world, there is not this level of damage to the GI. So we have to look at what's happening, how it's happening, and what this is all about. We have seen autoimmune diseases on the rise since 1986, has significantly increased. And right now, IBS and IBD and basically bowel disorders these are diagnosed either autoimmune IBD or ulcerative colitis, Crohn's, or any other ailment with the bowel that has been diagnosed as affecting over 3 million people in the United States. And since 1999, it was 2 million people in 1999, and now it's 3 million people in less than 20 years. So we are increasing at a really rapid speed. And these are the people that have actually gone to the doctor and been diagnosed. I know a ton of people that have not gone to the doctor and not been diagnosed, and they come in and they're like, I don't know, it's been like this for like 5 years. So we know that millions and millions of people are struggling with these conditions, and it's really, really important that we bring awareness around them. So IBD can be inflammatory bowel disease can be inflammation in either the small or the large intestine or both. And then colitis is basically inflammation of the colon specifically. So ulcerative colitis can begin from the basically ulcers in the colon and in the rectum. And I'm going to actually share my screen really quick so you can see this, because this will help you visually. There we go. So ulcerative colitis begins from ulcers in the colon and the rectum. So these ulcers are actually, there's many types of colitis, so I'll go through that. But this one specifically, hold on, I've got somebody in the waiting room. There she is. Okay. This type specifically is when you actually start to form ulcers all throughout the mucosa. So these ulcers are spots in the tissue where the mucosa has eroded. So we all have a mucous membrane that lines our stomach and lines the intestines. And this mucosa is incredibly important for the soothing of the tissues. It's incredibly important for nutrient absorption, that we have healthy microvilli. There's so many purposes of this mucosa. And this mucosa also acts as an antibacterial for bad bacteria or harmful pathogens. So when we have lost this mucosa, it's a big deal. We've lost our ability to fight against parasites. And when we have viruses coming in the system and we don't have this mucous membrane that really acts as an antibacterial and draws out bad bacteria, we need bacteria. So if you don't know, we are actually more bacteria than we are cells. So we have over 100 trillion bacteria in our body, and it is the major system in our body. So the antibacterial concepts that are going on right now are actually the exact opposite of what we need to be focusing on. We need to be focusing on increasing our bacteria and the diversity of our bacteria, and really repairing the gut and rebuilding these issues. So back to ulcerative colitis, these spots are spots in the tissue where the mucosa has eroded away and left behind open sores or breaks in the membrane. So this is like an example. Here we go. We would have mucosa here. This has eroded away and broken into the membrane. And this is where an ulcer forms. This is incredibly painful. So this is really sad when people are going through this. They're in a lot of pain. They can barely eat. They definitely can't have citrus. And these things that would naturally heal their body, they really have to avoid temporarily. So it's about an art of working through healing this. But this is the most common form of IBD, actually. So the most common form of inflammatory bowel disease is ulcerative colitis. So we look at the colon, and you look at this. Here's the mucosa, the submucosa, and then the muscle layer. It gets all the way down into the muscle layer. All right. And then this is another really interesting piece is in ulcerative colitis, basically you have cytotoxic T cells are almost always found in the colon with people with IBD, which suggests an autoimmune condition. So now they are looking at ulcerative colitis as an autoimmune condition. And the reason is it's not actually autoimmune per se, but the body is reacting in an autoimmune state. And here's why. We actually have really essential bacteria that are either fiber eating bacteria or we are feeding candida bacteria. Candida bacteria actually produce high amounts of what's called sulfites. And these sulfites create tons and tons of inflammation in the body. And when we have healthy bacteria, they produce T cells. And T cells are really like an anti-autoimmune. It's like building your immune system. So we see this flood of T cells often found in people with IBD. It's like the body is trying to go in and prevent the inflammation that's happening, which suggests the autoimmune reaction. But really, it's just our immune system trying to go send the fighter T cells there. So these people have higher levels of sulfites and they have higher levels of cytotoxic T cells. This is also from an overgrowth of bad bacteria and sulfite producing bacteria. Now, moving into what is Crohn's disease. So that's ulcerative colitis. Oops, hold on, we got another one coming in. And then Crohn's disease is a condition that causes the lining of the gastrointestinal tract to become inflamed. So this is like any part of the GI tract can actually become inflamed and may be affected, but it usually occurs in the ileum, which is the last part of the small intestine, or the colon. And this usually affects individuals between 15 and 40. Most common symptoms when you're looking at Crohn's disease is diarrhea, like consistent diarrhea. And it can be, if you're having diarrhea once a week, that is too much. I can't remember the last time I've had diarrhea. It's been several years, right? That's common. It's common, but not normal. Anemia, meaning you're losing a lot of blood, like low iron. Abdominal pain, unexpected weight loss, which is suggestive that basically the GI is not absorbing nutrition properly. So you are losing weight. Fatigue, which obviously you'll be incredibly fatigued when you're not getting proper nutrition because your gut is the foundation of human health. And then blood in the stool or mucus in the stool. So I have heard many people say like, I have like mucus coming out of my poop. Is that normal? That's actually, well, not normal. If you are losing the mucosa, we need to pay attention to that, especially if it's consistent. So it's really interesting. Here's a little chart. And so here's some of the other things that happen when we're dealing with Crohn's disease. So sometimes we'll have inflamed gums. This is one of the signs. You can have inflammation in the eyes. Some people get ulcers in the mouth because their GI is so acidic as well. They get skin ulcers and sores. So people that are like, oh, I have all this skin stuff. This is a direct reflection of not only the health of the lymphatic system, but the health of the gut. Stomach vomiting, when people are like, I just go through episodes of what is most commonly diagnosed in the Western field as gastritis, which is just unexplained gastrointestinal stress where it causes vomiting, diarrhea, abdominal discomfort, is actually a larger form, earlier onset form of IBD or Crohn's disease. Fever, weight loss, or decreased appetite. We mentioned those are some of the symptoms. Joint pain and swelling is always involved with gut injury, 100% of the time. And I'll go through that why later. Rectal bleeding, and then intestinal diarrhea, abdominal pain, cramping, or ulcers in the digestive tract. And then we see this liver and bile duct inflammation. And this is not surprising. If the GI is leaking, the liver will be incredibly inflamed because the liver's job is to pull out chemicals, things that don't belong in the body, process all the fats. And if you have, one of these conditions, if you have IBD, that means essentially you have a leaking gut. Now, I'm going to pause for a moment to explain the gut lining. So our digestion starts in our mouth via our saliva. And we have ptyalin and ptyalin in the saliva. Ptyalin produced by the saliva, ptyalin produced by the teeth. It breaks down fructose, glucose, galactose, and that's our fruits and our vegetables. And then the ptyalin breaks down more of our complex fats and starches. And this is the main hub of digestion. So if you have a dry mouth, this is the first sign of really bad gut health. And a dentist will tell you too, their most ill patients are dry mouth patients. So dry mouth is a sign of severe GI distress. And then when the food comes in, it goes into the esophagus, and then it goes actually to the duodenum, which is a holding tank where the pancreas secretes its necessary enzymes like insulin, amylase, hydrochloric acid releasing pepsin, etc. Once that is digested there, it gets dropped into the stomach lining. The stomach is a really important piece where we should have hydrochloric acid. We should also have this 2-inch mucous membrane that has ALA in it, alpha lipoic acid. Alpha lipoic acid is responsible for getting rid of harmful bacteria and heavy metals. This is the defense that the body has naturally. So if this lining or if this mucous membrane is gone, one, we lose that defense. And then number two, many foods that we're consuming and chemicals that we're consuming actually tear holes in the gut lining and cause a leaky gut or leaking membranes. So when the tight junctions are not all closed and there's leaking happening, it's like there's no protection from the outside world and the inside world. And every chemical that you're ingesting is moving unregulated into the lymphatic and into the blood system. And this overflows the liver because the liver is trying to clean up all of the mess. And this is how we get fatty liver and inflamed liver and bile ducts. A lot of times this is how we get sludge in the gallbladder if you don't have gallstones, because the body is trying to clean up the mess that is happening, and it's doing its very best and it's overwhelmed. So we have to repair this damage. Now, I'm going to go back to sharing my screen so I stay on task because I could talk about this all day. But individuals with Crohn's may experience like long periods of remission, really, really common, where they don't have any symptoms or they have very mild symptoms, but it's followed by what's called like a flare up. And when the flare up symptoms return, it can be super severe. And this is a sign that it's progressing. And so for some people, the symptoms might be absent for the majority of their lives. And then they come back and they're more severe than they ever were before because the issue was never actually resolved. The body was using T cells. It was trying to do its very best. And then at one point, we have just like a complete erosion of the tissue. And most commonly, you'll hear people saying, oh, they're going to take out my colon. That's the most common thing with colitis is they just take it out. When in doubt, take it out, right? No, wrong. Heal it. But in the medical field, it is believed that this is a non-curable disease. it is only treatable through steroids and a couple other modalities that they use. Now, we are not medical physicians here. I am not a medical doctor. I am a regenerative detox specialist and holistic nutritionist, and I work in traditional naturopathy. So I am just giving you preventative care advice and letting you know that your body is designed to heal when it's put into the right environment. But I'm not making any legal claims. I just want to make that clear. So there's many parts. I talked a little bit about leaky gut, but leaky gut is always a part of colitis, of IBD. It will cause painful swollen joints as it allows foreign proteins to leak into the bloodstream because the permeability of the gut lining is finally being connected to disease in the human body, which is awesome. They're finally starting to pay attention to like, oh, when we see RA, we actually always see these cytokine T cells. When we see IBD, we see the same T cells. So they're starting to pay attention that the gut permeation is actually the largest connection and cause to autoimmune diseases, and specifically arthritis and rheumatoid arthritis. And then we end up having, when the gut boundary is weakened, not only is the liver and the lymph and the blood being affected by all the toxins that are coming in, but in addition to that, your body is designed to clean up that mess. So you will actually invite in a parasitic environment. You will invite in a bacterial environment to eat up the excess proteins and starches that are floating around the system. And before you know it, you have fungal overgrowth. You have yellow toenails, you have a white tongue, you have cravings for sugar, salt, and starch, and all these things. And it's literally because that environment is there to clean up that which is no longer needed, does not support life, and is broken down or destroyed. So if you're, I'm just touching base on that, you can go back to my YouTube and watch the video on Candida I did not last Monday, but the Monday before. And that will make a lot more sense to you. I do visit the gut lining and all of this stuff. Now, there's many types of ulcerative colitis, and this one is called prostatitis, and this is bowel inflammation that's limited to the rectum only. So this condition typically affects less than 6 inches of the rectum. It's usually like the latter part, but it's still incredibly uncomfortable. But it'll cause rectal bleeding, rectal pain, and urgency in your bowel movements. Left-sided colitis is a form of colitis that has continuous inflammation that begins at the rectum and then just continues to extend all the way up into the colon as far as the splenic flexure, which is incredibly dangerous because the splenic flexure is incredibly important and your spleen needs to detox, your detox organ. So, the splenic flexure is actually just like the bend in the colon, but it's near the spleen. And so this will cause extra stress on the spleen, which is your body's ability to purify the blood. And then left-sided colitis also includes, I don't even know how to say this word, but proctosigmoiditis, I believe it's called, which affects the rectum and the lower segment of the colon, which is located right above the rectum, known as the sigmoid colon. So symptoms of this one is usually loss of appetite because of the way this bend is happening. And there'll be usually acid reflux, pain in the abdomen, especially the left side of the abdomen. So right side is usually liver bile duct. Left side is when we're dealing with a splenic flexure issue and this colitis issue. Bloody diarrhea and weight loss. Now, don't go self-diagnose yourself. You're going to be fine. But these are just good things to know. Extensive colitis is a type of colitis that affects the entire colon. So continuous inflammation begins at the rectum and extends beyond the splenic flexure, and it can actually go all the way through. So this will be when it's like IBD, where it's small intestine, large intestine, and the entire colon past the rectum and into the splenic flexure. Same symptoms there. So understanding that these are some of the symptoms that we're going to experience. Now, if you don't have these symptoms yet, that's great. I want to talk a little bit about getting, preventative care. So this doesn't just happen. It doesn't just happen. Your colon doesn't just start to erode the mucosa away and eat at the tissue and form ulcers. That doesn't just happen. That happens from one thing, and it's called acidosis and chemical exposure. So we are an alkaline species and we are meant to be eating like an alkaline species. So in America specifically, we eat nothing, almost nothing is alkaline. So we look at an acid and alkaline chart, and I want to pull that up for you just to give a visual for those of you that are brand new to this type of information. And it's really important to understand that what we put in our body matters. So I want to get into solutions instead of just talking about problems. But some of the solutions that you can do is changing your diet, which is really quite easy. It just takes discipline. So it's simple, but it just takes discipline. So I will share my screen one more time here and show you an acid and alkaline chart. So here's an acid and alkaline food forming chart. And you can see the American diet: refined salt, sugar, coffee, turkey, pork, beef, chicken, fish, pasta, and bread, all the pH of 1. This is a high acid. Rice, cheese, eggs, peanuts, butter, pasta, oatmeal. So these are, non-healthy, probably not organic for sure, but all of this is more acidic foods. So they cause inflammation in the body. So inflammation doesn't just happen, it is caused by repeat damage from acid forming and inflammatory forming foods. So the more you eat these types of foods, the more issues you'll have. Almost everyone I work with, I feel comfortable saying 100% of the people that I work with Crohn's or colitis or IBD, just changing their diet, they start to alleviate the symptoms. And that's great. But then we need to go one step deeper and we actually have to repair the damage. So when you get into the alkaline foods, you get into your fruits, your berries, and your melons and your veggies. These are cooling, they're hydrating, they leave behind calcium and sodium and magnesium ash. Whereas the acid forming foods, again, leave behind nitrogen, phosphorus, and sulfur, which are inflammatory, hardening mineral deposits. So we have to look at the chemistry that we put in. We are not a garbage disposal. I've heard so many people say to me, isn't our body just designed to detox? That's what it does. Well, yeah, but like even your garbage disposal breaks if you throw metal down it. Like even your garbage disposal will break if you put too much food down it. So you're not a garbage disposal, we're not a vacuum, and even those things break when we put the wrong substances in. So you have to understand, eating right for your species type, eating right for your body is going to include eating alkaline forming foods, hydrating foods, foods that are not inflammatory. Your most inflammatory foods are your meats, your grains, your dairies, and your sugars. And then processed food, if it doesn't grow on a tree, it's not really a food. Now, what else has happened? In 1980s, we started spraying crazy levels of glyphosate, which is the active ingredient in Roundup. And this is patented as an oral antibiotic. So not just foods are responsible for the damage that we're having, we are being damaged daily by all of our non-organic foods, by air and water that we're drinking that has glyphosate and metals in it. And glyphosate, if it's an oral antibiotic, it's literally constantly wiping out your gut biome. Every time you eat, you're wiping out your gut biome. And this will lead to other symptoms. Maybe you don't have IBD, but you have crazy joint pain, which means that you have leaky gut, which is early onset IBD, right? Maybe you don't have ulcerative colitis yet, and you don't have ulcers, but you have rheumatoid arthritis, or you have autoimmune disease, or you have Hashimoto, and that means that there's a leaky gut condition and there's a lymphatic condition. So no matter what it is, you can clean it up by alkalizing your body and repairing the gut biome. And so we work with those solutions so you can start working on your own. Dig into the YouTube on Wise Wellness, dig into, if you want to learn more about how we work with people, you can visit regenerateyourhealth.com and check out some of the protocols that we work with, but really nourishing the body and repairing the body with proper amino acids, removal of chemical pesticides out of the gut, and repairing the microvilli. So again, switching your foods will get you, asymptomatic, essentially. It will help you back up your symptoms. So go organic, eat plants, eat fruits. If you have active colitis, you will not be able to do citrus or certain fruits. I would start with slow and cooling fruits like maybe watermelon and papaya. Grapes will be too harsh and citrus will be too harsh. So you'll want to avoid those foods if you're in an active Crohn's, IBD, or colitis situation. But moving forward from there, that's just avoiding the issue. We now need to repair the tight junctions in the gut. We need to get the mucoid plaque out of the gut and repair the mucous membrane. So I highly recommend reaching out to the person that brought you to this call or sent you this video if you're watching this later. If you're dealing with any of these symptoms, and they can get you connected with the solutions that we work with. And we work with the highest caliber, organic, micronutrient rich superfoods and gut healing herbs that are scientifically proven to remove glyphosate and to repair microvilli in the body. So I hope that video was helpful for you today. And I'm going to stop recording and then open up for questions for anybody.